Good evening. Tonight's presentation will be on experts speaking about post-traumatic stress disorder in military veterans. Just a brief overview of post-traumatic stress disorder and what it is. It affects 8% of the U.S. population. It is prevalent in military communities based on the last 15 years of war and the frequency and exposure to traumatic events typically seen in combat situations or theaters of combat increase the likelihood of developing PTSD. According to the American Psychiatric Association, some of the risk factors include lower socioeconomic status, lower education levels, environment of family dysfunction, and social support, both pre, peri, and post-traumatic event. The military is seeking to determine risk factors that can associate specific personality and environmental traits that influence an individual's ability to be more susceptible to having post-traumatic stress. And the two main questions that are inherent in this process are, is there a best fit of personality and based on cognitive and intellectual abilities, and is there a best fit based on neuropsychological makeup? The neuropsychological portion is based on research that indicates some different size and volume shapes of the amygdala specifically that lead to a higher risk correlation for developing post-traumatic stress. Here we have our two experts. Our first expert is Dr. Brian Burns. He is a doctor in cognitive psychology, and he's a team chief at the U.S. Naval Research and Treatment Center. Dr. Burns is a cognitivist. He implements cognitive non-medication-based treatments that focus on systematically dealing with thoughts and emotions that are associated with PTSD. Some of these are exposure therapy, where he puts individuals in stressful situations that may cause triggers to having some kind of anxiety episode or inducing some type of flashback, which are all symptoms of PTSD, and then he helps that individual deal with that incident. Dr. Smith is she's a neuropsychologist. She works at the U.S. Army laboratories at Natick, and she is linking traumatic brain injuries and post-traumatic stress and some of the correlation that exists between those two things. And additionally, she has used functional MRIs in order to analyze the size and volume of the amygdala and made correlations between amygdala size and a susceptibility to having PTSD. PTSD is initiated by single or multiple exposures to a traumatic event. And according to Dr. Burns, behavioral cognitive therapies that include couples have had a great effect on decreasing anxiety in PTSD patients. For example, these couple-based therapies allow the two partners to both share what some of the triggers and some of the difficulties are inherent in post-traumatic stress disorder, and it allows the spouse or partner of the individual suffering from PTSD to gather what some of these triggers are and help to alleviate them or be aware of them for their partner. Dr. Burns has developed treatments for the Department of Veterans Affairs and recommends the website ptsd.va.gov, the PTSD section. Dr. Smith uses functional MRI screenings on participants, again, using that screening in order to pair some of the environmental risk factors with some of the physical size of the amygdala specifically. She links these two things together in order to generate a longitudinal, like a long study that's going to be done over a period of the next 20 or so years to identify who is actually at a greater risk for developing PTSD. This will enable the military to use that information and potentially screen candidates a little bit better and maybe not allow certain people to take certain jobs that may expose them to combat more frequently. The comparison between Dr. Burns and Dr. Smith, they're really on opposite ends of the spectrum. Dr. Burns and Dr. Smith both believe that PTSD is a relevant topic, but they use different. They're one of them is really trying to treat it, and that's Dr. Burns, and Dr. Smith is really trying to understand it a little bit better. References for this. Thank you for listening to my presentation.